So welcome to this video, and in this video I'm going to explain what happens in week 2 of pregnancy. So week 2 of pregnancy can be really confusing because technically you're not pregnant yet, but your body is preparing itself to be pregnant. Okay, so please stay tuned with me, and I'm going to explain bit by bit what happens during this week of pregnancy. So basically, week 2 of pregnancy is when your body is preparing for ovulation. Usually ovulation takes place around the 14th day, of the menstrual cycle. That is, it could be before or just after the 14th day. It just depends on the number of days that you have in your menstruation cycle, sorry. So what really is happening in your body is that your estrogen levels go up, and then you're in preparation for ovulation. And I want you to note that when your egg is usually released, it stays for about 24 hours alive. And then also note that the sperm of the male can survive up to 5 days after being released into the in the female body. So this is very important to note because of the timing. If you're really trying to get pregnant, you really should know this so that you can time on your sexual activity. So what signs and symptoms should you expect during week 2 of pregnancy? 1, there will be increased cervical mucus. Yes, cervical mucus will be increased, and it will be clear, stretchy, like the egg white. You see how the egg white is stretchy and very clear? So that's how the cervical mucus is going to appear. Okay, so you'll see that discharge in your vagina, and that is a very healthy sign of ovulation. So another symptom that you're going to see is you're going to have mild lower abdominal pain. Please, not all women experience this. So for those who experience it, it's an ovulation pain. So some women feel a slight pinch on one side of their lower abdomen, which is very normal during ovulation. Okay. And then someone can experience increased libido. This is because the sexual hormones have increased, and thus they increase your sex drive. So your body is naturally encouraging pregnancy. Remember, you're naturally prepared for pregnancy. Okay? And then another sign that you might see is breast tenderness. Your breast may feel sore due to the rise of estrogen hormone. So that you may see at the 2nd week of pregnancy. And then please stay tuned because I'm going to talk about a sign that most women miss as the last sign. Another sign that you may see is heightened sense of smell. So remember, you might experience heightened sense of smell even before you test positive for pregnancy. Remember, if you take a pregnancy test at this week, it's going to give you a false negative because implantation has not taken place, ovulation has not taken place. Okay, so you can experience heightened sense of smell at this time of pregnancy. And then some women might experience light bloating due to the hormonal changes that are occurring. So please note that these are not confirmatory signs of pregnancy yet. They're just signs that you might experience during the ovulation period. So Can a pregnancy test really be positive at this week? Definitely no. Because remember, the HCG has not yet been produced. So the pregnancy, someone detects pregnancy using the test by measuring the level of HCG. So it will test negative. It can give you a negative, which could be a false one, because maybe you're going to get pregnant. So it's not yet time to tell whether you're pregnant or not. So what is the nurse's advice for week 2? Please continue taking your folic acid if you're trying to get pregnant. Eat balanced meals. Avoid alcohol and smoking. You can track ovulation if you're trying to conceive. Track your ovulation cycle. And reduce stress as much as possible during this period. Remember, your body is preparing itself for pregnancy. Reduce stress as much as possible. So when do you see a doctor? During what sign can make you, what sign when you see you should go see a doctor? That is when you have severe abdominal pain at this time, and when you experience heavy bleeding at week 2. Remember, we said periods usually occur at week 1 of pregnancy. So at week 2, we don't expect heavy bleeding. And when you have fever or foul smelling discharge, you should see a doctor. So basically, week 2 is about preparation for pregnancy. Your body is preparing itself to become pregnant. So please, if you like the information that I've given, like this video, subscribe to my channel for more, and please stay tuned, because I'm going to release a week 3 video, signs and symptoms and what you should do in week 3 of pregnancy. Thank you for watching. Bye bye.